Let me know what. Good morning and welcome to the June meeting of Finance. Um, First up, well, first I should thank Janice. Hello, Janice, up in Buffalo.
Buffalo.
I know you took control and handled the chairmanship last month when I was
Yes,
the pond, as they say. So thank you very much for that, Janice.
you're welcome.
First up on the agenda, the adoption of the meeting minutes from that board, from that finance committee meeting. So moved. Thank you very much, Al. Janice, second. Thank you.
Second,
All in favor, aye. Aye, none opposed, no abstentions. Um, First up on the agenda is the Mount Sinai offering, and Matt going to present that. Did I miss
Thank
something?
you. No. Thank you, Mr. Chairman, and good morning, everyone. The Finance Committee is being asked to recommend to the board a 30-year bond issue in an amount not to exceed $340 million on behalf of Mount Sinai Hospital. And I wanted to make a note, this is the first financing that we've had with the hospital since 2011, so we're certainly looking forward to working with them again. The projects that you're considering this morning include financing and/or reimbursing costs associated with various projects at Mount Sinai Hospital, Mount Sinai South Nassau, and the St. Luke's Roosevelt Hospital Center. These projects include upgrades to air handling units, fire alarms, sprinklers, elevators, parking garages, electrical rooms, and information technology projects, among others. In addition, the projects identified include the construction of certain non-patient care areas of an outpatient facility that's located in Wantagh, New York, and that's in Nassau County, and this is for Mount Sinai South Nassau. The total cost of these various projects will be funded with bond proceeds that will be loaned to Mount Sinai Hospital, and each project will be used in connection with the operations of the Mount Sinai Health System. This financing will also include a refinancing of all or a portion of the Mount Sinai Obligated Group Taxable Bonds, Series 2017. Under security, it's noted that as this is an obligated group structure, the obligations issued under the master trust indenture will be secured by a security interest in Mount Sinai Hospital's gross receipts. Looking at the staff report, we go over a number of items. I want to start with utilization. It's noteworthy that for Mount Sinai Hospital in 2024, 5-year highs were recorded in both discharges and the occupancy rate. Moving on to their balance sheet. In recent years, current assets have declined. However, in 2020, the cash balance was artificially elevated due to several one-time items that year. And as those funds were drawn down and utilized over the subsequent years, cash levels normalized, contributing to the decline. Also, there's been significant support from Mount Sinai Hospital to the other hospitals in the system. And in recent years, the hospital has had to write off intercompany receivables. However, regarding balance sheet ratios, both the current ratio and their cushion ratio have consistently been above the recent statewide and DASNY medians, and this is a pattern that has occurred throughout the 5-year period shown. In looking at their income statement, revenue growth in 2024 was noticeable at about 19%. Revenue growth has been attributed to increases in patient volumes and payment rates, as well as a focus on revenue cycle initiatives. And it's worth noting that in 2024, a chief revenue officer was newly appointed to oversee patient revenue functions across the entire system. Management has other initiatives as management aims to standardize technology, streamline decision-making, and drive a culture of performance and integration. The initiative is guided by 3 core goals, and these include enhancing patient care and creating a seamless, coordinated healthcare experience, advancing cutting-edge research to improve health coordinated outcomes, and maintaining long-term financial stability. It's also worth noting that in looking at one of the key income statement ratios, their debt service coverage in 2024 was recorded at 5.52 and has consistently been above recent DASNY and statewide medians. And again, this is throughout the 5-year period shown. And finally, the expected ratings are Baa3, BBB, and we do have the recommendation memo from the Department of Health supporting the financing. Thank you.
Thank you. And I was going to note that the DOH has issued a recommendation to approve this. I'll also note, I think the Medicaid number, the ratio has stayed constant over the last 5 years or so, which is a good sign in this hospital world. Anyway, any questions or concerns, Al? Janice?
Concerned? No, question.
Question? Take them.
From $2,287,000,000 to $1,315,000,000. From 20 to 23. I'm just curious to know what happened.
COVID,
What's that?
COVID,
COVID? Okay.
elective procedures were. I'm sorry, I should let other people who actually know something what they were talking about.
Feel free to
Why
chime
stop
in.
me now? IT, healthcare.
Multiple things.
I think a
But
lot
she
of,
can't get her own heart.
That was it. I was curious. It's a big dip.
Al, you're asking about the current assets, the change in the current assets?
Yes, the change in current assets. I'm sorry, Matt, I wasn't clear.
No, that's fine. So, I was making note that the cash balance was artificially elevated, and they had these several one-time items, and these included a taxable borrowing, the receipt of CARES Act funding, and additional Medicare advance payments. So they had this buildup artificially, and then over the years, as those funds were utilized, cash levels normalized, but this did contribute significantly to the decline.
Okay. Thanks, Matt, for the further explanation.
Janice, anything?
No questions.
I think it's important the DOH is issued their.
It's very important.
Yeah,
So,
it's important.
Hearing no other concerns or questions,
None.
I'll ask for a motion to recommend that this be approved at the board meeting, which will shortly follow. Janice is,
So moved.
second, thank you, Al, all in favor, aye,
Aye.
None opposed. That motion carries, thank you. Next up is a TELP financing, and that is Juan Alvarez will be presenting. Juan?
Thank you, Mr. Chairman.
I guess.
Today, the Finance Committee is being asked to recommend to the board a TELP transaction for NYU Langone Hospitals in an amount not to exceed $60 million. The institution plans to finance medical, surgical, and other related equipment, patient care monitors, building services and central supply equipment, pharmacy equipment, and finally, IT-related equipment. I wanted to bring one issue to the board's attention. For disaster preparedness and risk management purposes, the institution operates 2 out-of-state data centers, one located in Carlsbad, New Jersey, and a second in Chicago, Illinois. A portion of the IT-related equipment being financed will be located in these out-of-state locations. The out-of-state IT hardware assets support critical data infrastructure as part of an integrated operation for the institution's facilities located in New York State for the treatment of patients in New York State. This is particularly important after the effects of Hurricane Sandy. I would also note the bond council has vetted this issue. Thank you.
Thank you very much, Juan. Always like these TELP financings.
Me too.
Recommend, any questions or concerns?
None.
Can I get a motion to recommend approval of this
So moved.
TELP at the.
Second.
Thanks very much.
Aye.
All in favor, aye, none opposed, no
Aye.
abstentions, that motion carries. Unless anyone has any questions or concerns for finance, I'll ask for a motion to adjourn so we can go back to the full board meeting.
So moved.
Very much. All in favor, aye, none
Aye.
opposed, no abstentions. That motion carries. So I'm gonna turn it back to our esteemed chair, who was recently reappointed as chair unanimously.
sorry, stuck with me.
Full company.
Thank
Thank you very
you for
much.
your help.
Thank you, Janice. Janice, for